Senate health care bill were made public today as Republicans try to gain enough support to get that measure passed. But as it now stands, 5 Senate Republicans have come out publicly as opposed to that bill. And a local mother of 3 who relies on Medicaid to support her family is worried about the Senate health care bill. In fact, she says her daughter's life could depend on it. 2 News reporter Maytal Levy has team coverage and breaks down the potential impact.
It's a pretty serious castle. She wasn't supposed to be here. She wasn't supposed to live, they said. And she's a miracle child.
Hope Robertson is a single mother of 3. Her youngest daughter, 4-year-old Angel, had complications at birth. Now she can't talk or walk and is prone to seizures.
She just got this wheelchair maybe a month ago, and Medicaid covered everything of it. And otherwise, I would have her in a stroller that doesn't fit her.
The price tag on the wheelchair alone is $11,000. Her prescription's about $500 a month, and Hope just had a hip replacement and requires therapy. Without Medicaid, Robertson would have to spend thousands of dollars every month just on Hope's medical costs.
I wouldn't be able to give her the chance at life that she has, but it would be nerve-wracking, it would be stressful, it would be impossible.
The overhaul laid out in the bill would cut federal Medicaid spending by $834 billion over 10 years, despite White House statements to the contrary.
A little negotiation, but it's going to be very good.
The plan that we would put in place would not allow individuals to fall through the cracks.
Angel and her 2 big brothers are in a summer program at United Rehabilitation Services in Dayton. Hope says the organization plays a major role in her daughter's life. URS Executive Director Dennis Grant says 90% of their adult clients rely on Medicaid, and coupled with a looming state budget, it could be the perfect storm.
I just want people to understand how important Medicaid is to people with disabilities, and that when we make decisions about reducing entitlements, that we're making decisions about how people are able to live and whether they're able to live. This is a big deal.
That's why Hope has a message for the Senate.
Put yourself on the other side of this. It's easy to say we're going to do this and we're going to do that, but you don't live that life. You've never had to really be there firsthand to go through those kind of obstacles and really think about us from the other side, what we have to go through just to give our children the same opportunities.
The URS Executive Director hopes no matter which way the public feels, they'll get their voices heard and call our senators. The Senate is hoping to vote on it before the 4th of July holiday, but nothing has been officially set. Maytal Levy, 2 News, working for you.
And new at 6, Senator Rob Portman sharing his thoughts on the new Senate health care bill. He co-hosted the CNBC program Squawk Box today and spoke directly about the Senate draft of the bill. Portman says he feels there's a lot to like about the Senate version of this bill, but he still has concerns, especially when it comes to Medicaid.
Well, it makes an overall reform of Medicaid, giving it back to the states, more flexibility. I think that's a good thing, actually. But then it cuts it back in terms of the federal share to the point that I think it's very difficult to imagine the people who are now getting the kind of coverage that they need, particularly with regard to treatment on the opioid issue, will be able to continue to have it.
And Senator Portman also spoke about things like tax reform, North Korea, and regulatory reform. We'll bring you more of his comments on CNBC coming up tonight on 2 News at 11.